Hi everyone, Neil Kravitz here. I hope you're enjoying these daily clinical pearls. This clinical pearl is about appointment intervals. How much time should you allot between appointments? This will vary depending on the busyness of your practice and how much Invisalign you do. But in our office, the average appointment interval is about 10 or 11 weeks between appointments. So a patient comes in, we make an adjustment, and we'll see them 10 or 11 weeks later. I think if you are a young orthodontist and you are just starting your practice, I think you should see the patient more frequently, particularly if you do not have a busy waiting room. I think it's important just for you to see the patient, for you to get used to the mechanics of changing elastic ties, for new patients in your waiting room to see a busy practice. But I think if you're an established practice, I think about 10 weeks is about average for appointment intervals. If you're an adult patient, I will see adult patients every 4 weeks from the start, so I do not let them go. If you're a complicated case, I'm seeing you every 4 weeks. If you have impacted canines, I'm seeing you every 2 to 4 weeks because I am activating those teeth frequently, except if they're in Isoglide, we don't need to activate those. But if I'm using elastic thread, I'm reactivating those every 2 weeks. So there's a lot of information here. Okay, so if you're a new practice, I think every 4 weeks is fine. I think if you have ectopic canines and I'm using elastic thread to reactivate every 2 to 4 weeks. If you're an adult patient, a complicated case, a periodontally compromised patient, every 4 weeks. But if you're just a routine patient, I think every 10 to 11 weeks is fine. Now here is the kicker. Once you get past 20 months, I want to see you every 4 weeks. That way we can finish on time at that 24-month marker. So the staff on the treatment tray before I come over will have the patient's name and then the amount of time they're in treatment. They've been in treatment for 20 out of 24 months. So I know that I have to start scheduling them every 4 weeks after that 20-month interval, and that way we can get them done at that 2-year marker right on time. So give this pearl a shot. Let me know what you think. Let me know what you do for your appointment intervals. Thank you guys so much for subscribing to this page. I hope you're enjoying it. Thank you for supporting the JCO.